Well, I'm excited to have this opportunity to come speak with you. This is the first time we've actually addressed these here at the health campus. It may be that I didn't know about it and it was actually done earlier, but certainly this is a news opportunity for me. Being the first person, let me get an idea about who we have. Let's look at the nursing people. How many of you represent nursing? Okay. Physical therapy assistant. Do we have some occupational therapy assistant? Surg tech? Paramedic? Laboratory? Anybody I missed? Okay, give me an idea of who to kind of look to periodically. And as I was thinking about this, I thought, my gosh, in 5 minutes, I don't know if I can do this. So I'm going to be looking at you very closely. I wanted to talk about integrity first because I thought that was probably a #1 thing that I thought I wanted to address. As a matter of fact, nurses for the 14th year from the Gallup poll on health professions, they are seen as the most ethical. When you're talked to the general public, for the 14th year in a row, nurses are the most ethical profession. Other professions are seen as very ethical as well. When we look at patients, patients are vulnerable individuals. They give you the control that they normally have, and they leave it and put it in your hands. So they turn over their bodies to you, they turn over their lives to you to meet their needs. So you're trusted to meet those needs according to the plan that's devised for the healthcare team. So do your job. That's an important piece. We talk about oral and written communication. It is so important that you be able to communicate with your patient. And by the way, reimbursement from the hospital is now based on what kind of a relationship you have with that patient. Now, not all patients, after they are discharged, receive a survey, but some do. And you better hope that the PTA who worked with them, the lab person, the OTA who worked with them, especially the nurse who worked with them, was able to establish a very positive relationship with them. That makes the difference in whether the hospital receives bonus money or not. You're also going to verify what you have done for your patient. You may hear later on, if you don't document, it's never done. So your written communication is so important to the legality of a hospital or facility and to the functioning of your healthcare team. When we talk about the healthcare team, we're also talking about working together. Now, all of you are sitting here, and at one time or another, you may all be together on a healthcare team. It's not just nurses and doctors on a healthcare team. It's the dietitian, it's the PTA, it's the OTA, it can be the lab person. And so you're all on the healthcare team. You're all making a difference to the patient. It's essential for you to get the work assigned done, and you have to develop a game plan every day. And I always saw that as being kind of a thrill, if you could say it, because it was my game plan for the day and who I needed to involve in my game plan to get my work done. Time management is so important. When we look at over the course of the day, if you're working a 12-hour shift, it will be important that those 12 hours are filled with lots of information and lots of duties. You're communicating to your partners about what you've done, but you have to do what is said to be done. So therefore, you can't just skip it because you don't have time. You don't skip the medication because you don't have time to give it to that person. You're responsible to give all care, every time, all the time, and on time. Workplace ethics is probably a big piece I wanted to talk about. That's the last thing I wanted to tell you. There's so much. There is so much bullying going on in the healthcare setting. If you bullied as a child, you continue to bully. Or if you've received bullying, you continue to do the same. So certainly, look around you. Know how to handle it. Work with it and expect it, and then know what you need to do to work with it. There are laws preventing confidential information. So you have to be sure that workplace ethics say that you are going to keep confidential that information about the patient or about what's going on during the day. And the last thing I want to tell you is find your passion. No matter what the setting, find your passion, work with it, and enjoy it.